The U.S. recorded more than 150,000 new COVID-19 cases last week. Officials are now concerned those numbers could spike as people travel home from their Labor Day weekend plans. Deborah Alfarone reports from Washington.
Public health officials are bracing for another possible COVID-19 surge. TSA officers screened more than 5.3 million passengers over the long Labor Day holiday, despite CDC warnings, especially for the unvaccinated, to stay home.
If there were a lot of people who were unvaccinated that were traveling and they didn't wear masks, they didn't use appropriate social distancing, and they weren't washing their hands, we could see a lot more disease activity in the coming weeks.
Last week, the U.S. averaged more than 150,000 new COVID cases and more than 12,000 new hospital admissions. 53% of the total population is fully vaccinated, leaving just under half unprotected.
The risk of infection, just infection itself or serious infection, is so much higher with people who are unvaccinated.
Hospitals are stretched thin. A Washington Post tracker finds that the number of hospitalized COVID patients has more than doubled since last Labor Day.
Rural hospitals are especially struggling.
So 20 patients in the hospital, only one does not have COVID.
Dr. Hassan Kakli works at El Campo Memorial Hospital in Texas. He says wait times in the ER are unprecedented.
You would never see 4 digits on minutes since checked in. We're 4 digits on the thousands of minutes.
And a last resort move in northern Idaho, where facilities can no longer handle COVID patients. Crisis standards of care are in effect, allowing hospitals to allocate resources to the patients most likely to survive. Deborah Alfarone, CBS News, Washington.
For more on this, I want to bring in Alexander Tin. He's a CBS News reporter covering public health and the pandemic. Alex, welcome. So more Americans are vaccinated this past Labor Day weekend compared to last. So what happened? Why are we seeing this surge?
Well, the short answer is the Delta variant, right? We know that the Delta variant, compared to the ancestral strain of COVID-19 or the strains of COVID-19 that we were facing last Labor Day, is significantly more transmissible, not just in unvaccinated people. That's a well-known and concerning risk from the Delta variant, but even among some of those worrying, uncommon, but potentially, transmissible breakthrough infections of people who are fully vaccinated. So when you put those two pieces together and then you combine them with the circumstances you just heard about, which is the relaxing of so-called NPIs. That's non-pharmaceutical interventions. That's a fancy public health expert way of referring to simple things like mask wearing and social distancing and reducing indoor dining, the things that we know reduce the spread of COVID-19 and other viruses and pathogens like it, that you really see not just the risk, but actual outbreaks all around the country of COVID-19, both among unvaccinated mostly, but also among some vaccinated people. And that risk is obviously compounded by the fact that not only did you see that huge surge of travel over the Labor Day weekend, but you also saw already high transmission going into the weekend. The last time that I checked, the CDC's county-by-county tracker of transmission showed 95% of counties already at high transmission of COVID-19.
Well, in Ohio, a judge just reversed an order requiring a hospital to give COVID-19 patients Ivermectin. What is this drug normally used for, and how did it become part of the COVID treatment debate?
Yeah, well, to be clear, Ivermectin is an FDA-approved treatment in some formulations to treat things like, parasitic infections in your digestive tract, head lice, other skin ailments, right? And in those specific situations, the FDA and public health experts say there is a clear benefit outweighing the risk for those ailments. Where we don't have conclusive evidence for that is COVID-19. And what we've heard from the FDA and from federal public health experts that have looked at the emerging science around ivermectin is we just don't have enough data yet to show that ivermectin actually benefits patients with COVID-19. There have been methodological errors with some of those studies. There have been issues where one of those high-profile studies showing ivermectin had benefits was retracted. And there have been other studies showing that potentially ivermectin didn't lead to an improved outcome in patients with COVID-19, and they actually saw the same or worse outcomes with COVID-19. But again, we don't have clear evidence on ivermectin yet. It's possible if we talk again about this drug, 2, 4, 8 months ago, or 2, 4, 8 months in the future after more clinical trials have concluded on ivermectin, that we may know that there are some subsets of people who have COVID-19 that might actually benefit from this treatment. But we don't have clear evidence for that yet. What we do have evidence for, and what has prompted the CDC and the FDA and all these other federal public health agencies to really warn against misuse of ivermectin, are people who have gone out and attempted to get off-label use of ivermectin, not just in the human formulations, but also in the formulations that we see for animals, at cattle stores or other animal health clinics, and have taken those formulations of the drugs, potentially overdosed on it, and seen really worrying side effects or other issues that ended them up in the hospital, hospitalized, not just for the COVID-19 that we're trying to treat, but actually the side effects of that ivermectin overdose. Those are the really worrying situations that federal public health experts have issued warnings now trying to reduce.
Alex, as you know, only kids age 12 or older are now eligible for COVID vaccinations. When might we see approval of vaccines for kids under 12?
Well, the short answer, and this has been the answer for a few months now, is we expect there could be a COVID-19 vaccine available for a younger age group, 5 to 11 years old, probably in the late fall or early winter. And just to give you some example of that timeline that we know going into that, Pfizer has said for a while now that they expect to have data from their trials looking at the safety and efficacy of their vaccine in people 5 to 11 years old at a smaller dose level sometime within this month, and an application to the Food and Drug Administration sometime next month, right? That's October. And the FDA has said that they hope to process and review that data and potentially issue an authorization within, quote, a few weeks, not a few months. That puts us in the late fall to early winter, where some people can at least start getting the Pfizer COVID-19 vaccine, likely at a lower dose for those younger age groups.
And what is the latest guidance, Alex, on booster shots, which are meant to be rolled out in the next couple of weeks?
Right. So remember, we heard from the White House a little bit ago that September 20th, that week, was really their goal date for rolling out booster doses of the Pfizer vaccine and the Moderna vaccine for people 8 months after their first shots were completed of COVID-19 vaccine. Now, what we've learned since then is a few things. Number one, while Pfizer has steamed ahead with their application, submitting data to support the use of their COVID-19 vaccine as a booster dose, as that third shot, 8 months potentially, or maybe even sooner in people after they finish their first vaccinations, Moderna also submitted data, but their data was on a smaller dose of the vaccine. That's a 50 microgram dose. And that prompts concerns for a few reasons. There is obviously the logistical concern of, changing the dose size from a bigger to a smaller dose size. There's also the concern that maybe it's not as efficacious or safe, or we might have other issues that come out of that. What we know now is that federal regulators, federal public health officials are waiting for more data from Moderna before they sign off on the booster plan for Moderna shots. We heard Dr. Anthony Fauci say over the weekend on Face the Nation, and again today to NPR, that he expects that determination pushes Moderna's availability back maybe 1 or 2 or a few more weeks behind Pfizer's. And so what that means for us is that likely Pfizer's vaccine booster shots, probably September 20th, Moderna's vaccine booster shots, maybe a few weeks after that. And then obviously there's the Johnson & Johnson booster shots, which we can talk about another time, that they're still waiting for data to support the efficacy and safety of.
All right, so many people watching those timelines very closely. Alexander Tin for us. Alex, thank you very much.
Thank you.